In this tutorial, we'll go through the craniomaxillofacial surgery workflow in Planmeca Romexis. So first, we have created here a patient, and we have already captured or imported the needed data for this patient. So we have a CBCT, full skull volume, then we have the lower pre-op model, upper pre-op model, and then also we have the target occlusion scanned. So this is the occlusion that we want to achieve for the patient with this virtual planning. So then let's start by opening the CBCT by double-clicking on it. So the volume gets opened here in the Explorer submodule, like we can see there on the top part of the screen. And now here in Explorer, we need to do some preparations. So firstly, let's fit the pre-op models together with the CBCT data. So we open this Fit Model tool here on the right side toolbar under Tools, and we get this dialog opened. So now that we already have these pre-op models imported or captured for the patient, so they are already inside Romexis, we click there on Select, and now we select either one of the pre-op models and click OK. So now first we're going to fit this upper model. So the model is here on the left side, the CBCT on the right side, and how we fit these two data sets together is that we as users need to give 3 common points. So we're looking for some parts of the teeth that we can well recognize on both models, and we're marking them with our left mouse button. So with the right mouse button down, we can manipulate these data sets here on the views. And with the left mouse button, we're looking for these points. And it would be good to select those points far away from each other so that the software has a better starting point for matching the data. So now we can see also there on the lower right side of this dialog that we have marked 3 points, and the background behind those points is green. So that means that we have successfully selected the points. If it would be yellow, there might be the risk that it could be a little bit more difficult for the software to match those models. It probably still could succeed. If it's red, then maybe we would need to redo selecting those points. You can also see there on the top part of this dialog that arrow that points backwards. So we could remove the points using this arrow and we could reposition them. But now everything looks okay, so now we could click on Done. And now the software starts the automatic matching process between these two data sets. So it's taking those 3 points and it's looking for a common surface around those points. So then when this algorithm has stopped calculating the match, we could then manually verify the match and adjust it when needed or continue. So now it finished calculating, and now we could verify the matching result. We can also then verify it later in the slice views. So let's use this automatic match now. And we could now see there, for example, if we zoom in the sagittal view a little bit and we browse through the slice stack, we could verify that this outline of the intraoral scan seems to be in place. And now we can repeat this process for the lower model. So again, we'll select the Fit Model tool. And again, we'll go to Select, and this time the lower model. And let's do a new match. So the software found some kind of pre-existing match, but let's repeat the process like for the upper model. So selecting 3 common points using our left mouse button from different sides of the dental arch. So first, again, always we place the point first on this dental model, and then we'll look for the same point on the CBCT data. So again, we got this green background, so we just click on done in order to launch this automatic matching process. So again, it's looking for a common surface around those points. So it's optimizing the matching. It's done, not done only based on the points that we gave, but that's just like a seed points for the algorithm. So now again, let's use automatic match, and now we could also browse through the slice stack. So we could of course browse through any of these slice stacks in order to verify that the models are in the right place. And now something very important that we need to ensure for this surgery workflow is that the models are marked to the right jaws. So these arrows next to the models here in the object browser indicate to which jaw they are attached to. So we could hide the models in order to verify that we have the right ones attached to the right jaws. So if it's an upward pointing arrow, it's attached to the upper jaw, and the downwards pointing arrow indicates that the model is the lower model. So make sure that those arrows are marked right. If you would need to change the arrow, you could just click on top of the arrow and it would change the direction. Okay, so then one more preparation step here in the Explorer submodule. So we need to segment the mandible separate of the data. So we're going to segment the mandible and maxilla separately. And now we clicked on yes when the software asked us if we want to use the surgery module afterwards. So this is also important because then it saves this segmentation result in the right way. So now we have this wizard that has opened on the right side. And first what we'll do is that we're going to mark 5 anatomical landmarks into data. So like you see there on the right side toolbar, first we're going to mark condyle left. So we mark it by keeping Alt down on the keyboard and using our left mouse button, and automatically the software moves us to the next point on the list. And now for this occlusion point, we're going to use the 3D rendered view, again with Alt down on the keyboard, and with left mouse button we can mark those points. So we need to mark those occlusion points as far back as possible on the occlusal surface when it's about those right and left occlusion points. And when it's the frontal occlusion point, we'll need to mark it as far front as possible. So as a result, we get those red areas marked. And now we could move on to next step. So now we have this paint marked on our data. So wherever we see this red paint, that's going to be part of the lower jaw, and that works as a sort of a stopper for the segmentation. So it will stop there. So this one prevents the segmentation from flowing to maxilla, so it knows where the mandible ends. And like you see, it might be because this paint was placed here based on an automatic process. So it might be that that paint is included in the maxilla as well. So if you would like to, you could remove the excess paint by using your right mouse button and dragging. And you could add also paint if, for example, in the lower teeth, or all of those teeth wouldn't be marked with the paint. So you could add paint with a left mouse button. So adding paint with left mouse button, removing with right mouse button. And we could also change the size of the cursor by keeping Alt down on the keyboard and by using our mouse wheel. So we could make also finer details. So it's not very important that the paint is strictly on the mandible and not in the maxilla, not for this surgery process, because basically those parts are on the condyles or on the teeth, and we're more interested in the mandible bone. But if you would like to, you could make these adjustments. So you could browse through the slice tags and fix these paintings. But let's now continue with these. So let's click on next. And now what we'll need to do is that we need to give some seed point for the segmentation on the mandible. So wherever there's quite a dense bone, we'll click there, and that works as a starting point for the segmentation. So now we already got some initial segmentation, and we'll move on to adjusting the threshold. So here we can adjust the threshold of the segmentation with this slider in the wizard. And we would like to keep this rather low. Okay, if we put it too low, then there's the possibility that the segmentation doesn't succeed. Let's see if we try this. Yeah, like this. So now it didn't stop there in the mandible. So if it's too low, we might get a result like this. But then on the other hand, if we set this threshold too high, then there's the risk that we have lost some bone surface. So we want to preserve the bone surface. So it's better to keep it as low as possible, still preserving this segmentation result. So let's continue with this kind of result. Let's click on finish, and now we finish with the segmentation process. So then, now after these preparations, we continued at the surgery sub-module. So you can see that sub-module navigation there on the top part of the screen. So now we are in the surgery module. And now, well, we have here the 3D rendered view on the right side. Then we have the slice view, and we could also change. Now we have the sagittal slice, but there are these controls with which you can also change to axial or coronal slice as well. So this is our slice view, and then there on the bottom left side we have also the dental models, and here also we have the controls for determining if we have both or just the upper or lower jaw dental model visible. So let's then continue with the surgery planning process. So the first step that we need to do is here under surgical tools, add anatomical landmark. So here we get a list of landmarks that we need to mark. So here all those landmarks that are marked with red color are those that are still missing. So those are the ones that we need to mark now. And we can just follow the list through, and we can start marking those cephalometric landmarks. So again, keeping Alt down on the keyboard, we can mark the landmarks, and we can mark them on any of these data views here. So some of them we put there on the 3D rendered view, then maybe here on these slice views we can more easily recognize some of these points. Then again, moving to 3D rendered view. So on all of these views, we can mark the points by keeping Alt down on the keyboard and by using our mouse wheel, left mouse button. And then we're moving on to dental landmarks. So those we mark here on the dental model. And by the way, now you see that those landmarks are not red anymore, those ones that we have already marked. So wherever the landmark is gray, that means that we have already marked the landmark. It's always possible to remove a landmark by using the trash can icon next to them, or then if there would be the need to reposition some landmark, we could also select it on the list, and we could redo the positioning. So once when all of these landmarks are defined, the software gets information for the right head orientation, but next we can still manually adjust the right head orientation, because our patient might not have that symmetrical anatomy. So here we have the possibility of still defining what is the correct head orientation in our opinion. So we can use these handles here in order to rotate the skull, and the arrows for adjusting the vertical and the horizontal plane. So those planes, they were automatically set there based on the landmarks that we marked in the data. But like said, we also have the possibility for still adjusting it manually. And we could use the threshold slider and the brightness slider in order to understand the data better. So when that's done, let's click on Done to continue. And now we have the head orientation that we defined. So then we can move on to selecting the osteotomies for cutting the bone. So now we had already selected this Lefort one piece. So like we see, there's also other option, and maybe later on some further options as well. Okay, and now before we adjust the planes for the maxilla, the cutting planes, let's add a root point. So we activated this root point marking tool in the toolbar, and we're selecting that point with Alt down and with our left mouse button. So there we mark it there in the slice view, where we can see where the root finishes, where's the root tip. So these root points help us in understanding where do the roots finish, so that we avoid the risk of placing this cutting plane on top of a root. So we're not going to cut a root. And when we are moving these planes, these osteotomy planes, we can also see there dynamically next to the root point what's the distance between the root point, so the tip of the root, and the closest cutting plane. So we can also dynamically monitor that there wouldn't be the risk of cutting the root. And when we have placed the cutting planes in place, we can then apply the cutting, and now we get this bone segment separate. So now it cuts our maxilla using that plane as a guideline. Okay, so now we have this separate bone fragment here. Then we can move on to mandible. So now we were in maxilla, now we move on to mandible. So of course you could plan your surgery using only maxilla, or cutting only maxilla, or cutting only mandible. In this case we're going to cut them both, but up to you and your surgery planning. So now we can adjust these planes. Like you saw, we can move them by moving those dots that are on the corners of the planes. Okay, so we're just adjusting where to cut this mandible. Okay, and then when we are moving the planes, there are basically two modes. For example, now we could move it like this when we don't have any keyboard, any key on the keyboard pressed down. But then, if instead we would like to use these control points and move the plane that is controlled by them, we could keep Alt down on the keyboard. So this is another possibility for us for defining the position of this cutting plane. And now when we have finished defining the position of the cutting planes also for the mandible, we can click on Cut in order to apply the cutting and to separate also the mandible fragment. So now, like we see, we have the bone fragments visible. So we have them as separate fragments from the data. And we could open this bone segment branch view, and here we could select the different fragments. So for example, now we have both mandible and maxilla selected. And here we could adjust the visibility of them also using these eye icons here. So we could use this branch view, so you can find this tool under the 3D rendering tools, that first tool there. So you can open this branch view, and you can control which segments are selected and visible. So that segment that is visible is also marked with this like a brownish or yellowish color in the view. And now we'll move on to importing the target occlusion. So this was the occlusion that we had defined in the beginning. So the occlusion that we want to achieve for the patient. So again, we go to select, and we select the target occlusion from here. Okay, let's still define the right orientation for our target occlusion, so we can use those direction shortcuts there in order to view it from different directions, and then we can use these handles and the grid to help us in defining the right orientation. And let's click on OK. And now we're going to match the pre-op models of the patient with this target occlusion, and we do it by marking common surface or common areas on these both models. And we can do it by using this painting tool. So we just paint common areas on both models, and we can mark the areas also on the other sides in order to give the software more data based on which to do the matching. So let's apply some more paint. And then finally we could click on fit models. So now the software fitted these two models, the pre-op with the target occlusion, using the common areas that we defined. If there would be the need to modify the areas to apply more paint, we could click on that before continuing, but let's now continue with these results. So let's click on next, so that we can now repeat the process also for the mandible, for the lower model. So again, marking as much data as we can, and then clicking on fit models and letting software fit the models together. And then we can finish by clicking on OK. So now it's finishing the fitting process. And now we get back here in this view. So now the software has moved the bone segments to achieve this target occlusion that we just matched with the pre-op models. So now the dental models are in the target occlusion, and the bone segments have moved accordingly. And here in Object Browser we see saved positions. So we have the initial position where the bone segments were after cutting, after making the cutting, and then we have this target occlusion position. So these are here automatically saved. So this is now the position where the bone fragments are moved in order to reach this target occlusion. And now we can go here to set move mode under surgical tools, and we have this dynamically updating landmark movements table. So here we can see information about our anatomical landmarks, and we can check that table when we are now moving the bone segment still manually. So we have here this option of moving the selected segments. So again, like you remember, the selected segments are the ones that show in yellowish or brownish color, and then we can use these different controls in order to move the bone segments. So we have those controls there, and then some more. So all of the bone fragments that are selected currently will be affected by these by these controls that we are using. And then we have this other option, rotate around condyles. And now here, like you remember, there was this green bar that was marking this rotational axis between the condyles, and now the jaw is rotating around this rotational axis, so we can determine the rotation using that control there. And then we can save this position. And now if we have both, if we're going to cut both jaws, we could select if we want to cut maxilla or mandible first. So that will be then saved as intermediate position. And then we have the final position also, where both segments have been moved, or both jaws have been cut and moved to the new position. So now we're going to save the intermediate and the final position. So we can see those also now there in the object browser under saved positions. And for this final position intermediate, it's also possible for us to define how that's called, like the opening of the jaw. So we have this small slider here, so we could use this in order to determine the opening of the jaws in this intermediate position. So those are automatically saved here, so we can always toggle between these different positions. And now we're going to create a splint for this final position. So we go here under post planning, the splint design process. So of course we could have selected also intermediate position and continued this splint design there, but now we selected final position, and now we get here to this splint design dialog. So here we have view on the splint from different directions. With these sliders we can determine the thickness of our splint, so we can just simply drag on those dots in order to define how thick our splint would be. And here on these bottom views we can determine the area of the splint that it's covering on the occlusal surface. So we can just grab on these control dots in order to modify the area of the splint. And we can also use this other view for adjusting the splint area. And there in the middle we can see the preview of our splint that we're forming. And we can also add fixation holes or holes on the splint, so they will be marked like these bars. So we activated this one icon there on the top left corner. So these are the holes that we can use for fixing the splint with the brackets of the patient. So now we would have those holes on those positions. So let's not put those holes too close to the border of the splint, so that we will have them successfully in the final splint. And when everything is ready, let's click on Generate Splint, and we have to still accept this disclaimer. suggested by the software. So we take the responsibility for our splint. And now we're generating the final splint model. So this splint we can always export in STL format from Romexis. So if we have a 3D printer ourselves, we could print it or send it somewhere else to be manufactured. And like I said, these splints we could have created also for the intermediate position. And now still checking the preview for the final splint, and then clicking on OK. And then we get out of the splint design dialog, and our splint appears here, and we can see it there attached with the final position. So it becomes an element here in the design view. And we could, of course, browse through these slice views in order to verify that everything looks good with the models, with the bone segments and the splint. And here on the top part of the screen, on the upper toolbar, we can also see these export objects as STL files. So this is the way how we could export our surgical splint in STL format from Romexis. Okay, so that was a quick overview of our craniomaxillofacial surgery workflow.